And health officials across southeast Michigan are keeping a very close eye on 3 measles cases in 3 different counties right now. They're the first cases in the state since 2019. Now, to get some insight into what's going on right now and what can be done to keep it at bay, we're joined by Dr. Abdul El Sayed, Wayne County Health Director. Thanks so much for joining us, Doctor. So we know measles is very contagious, but we haven't yet seen active cases in this area in a long time. So explain to our viewers exactly what measles is.
Yeah, so measles is a respiratory illness that unfortunately can be deadly. 3 out of every 1,000 people who get the disease will die of the disease, and then it can recur in a different form later on, even among people who have recovered. As you said, measles is one of the most infectious, if not the most infectious virus known to humankind. And to put in perspective that people all understand really well, for every 1 case of COVID, that case will go on to infect 4 new people, assuming they're not vaccinated. If you were to put 1 case of measles in a room with people who are unvaccinated for measles, they'd spread it to 18 people. In fact, 9 out of 10 people who are not vaccinated who are exposed to measles will go on to get it. And what makes this even more dangerous is that for people under the age of 1, so babies, they can't be vaccinated. And so it is critical that folks who can be vaccinated get vaccinated. And part of the reason we're seeing so many new cases, 3 in the last week and a half after 5 years of no measles cases, is because we're seeing large outbreaks out of Europe. And so each of these cases has been associated with international travel. Now, we know that it's only a matter of time until it comes here. Why? Because unfortunately, because of mis and disinformation about vaccines during the COVID era, we've seen more people make a disastrous choice not to get their kids vaccinated, which has opened the door for measles to come and hit us. And I worry about what that might mean moving forward.
And with that worry, Doctor, how would someone know that they've been potentially exposed, and what are some of the common symptoms?
Yeah, so the common symptoms are very similar to what you would expect with something like the flu or COVID. You're going to have a fever, you're going to have a rash, potentially, sore throat, fatigue, body pain. But one of the most important things, the telltale sign of measles, is a rash, and it looks like almost somebody wrote on your body with some kind of highlighter, right? And it shows up in this sort of silky design on your body, and that's the telltale sign. But here's the problem. You're infectious with measles, right? You're possibly shedding virus up to 4 days before you ever get that telltale measles rash. And so it's plausible that people can be exposed by people who don't yet know that they actually have measles. And in the case in Wayne County, we know that the individual who is now currently isolating as per protocol made visits to a couple of different public places, CVS in Dearborn, 2 different urgent cares, and then the emergency room at Oakwood. And we encourage people to go to waynecounty.com/measles to see whether or not they might have been in those places. They'll get the information about the places and the times that individual is there. Yeah. And if so, we encourage them to email us and we can help them ascertain what they need to do next.
And Dr. El Sayed, you mentioned briefly that there is vaccine available for some people. Who can get the vaccine, and is it a viable vaccine?
Yeah, everyone over the age of 1. It is extremely safe, extremely effective. Our parents understood how safe and effective it was because they knew what measles looked like. They largely knew people who had measles, who recovered from measles, or maybe didn't. And so they made good decisions, getting us vaccinated, making sure that we're protected. And, unfortunately, too few people are making that decision for their kids. I'll tell you, my kid just turned 1, and almost as soon as she turned 1, we took her to get her MMR vaccine. She's now protected. I'm so grateful that she turned 1 before we had these first cases. So I'm hoping that folks will go make that same decision. None of us are asking you to do something that we didn't do or do for our children. So if you are worried about your vaccine status, you can go to waynecounty.com/measles. There's a link there to check whether or not you've been vaccinated, or if you're over the age of 18. And if you're worried about your children's vaccination status, talk to their pediatrician, make sure they got their MMR vaccine. That's what will protect them.
Yeah, thanks so much for pointing that out. We do know that many health departments and healthcare providers are offering MMR vaccines. Dr. El Sayed, thank you so much for joining us today. Karen, let's send things back to you in the studio.
All right, we have been compiling our coverage of these recent measles cases on clickondetroit.com. So just scan the QR code right on your screen, and it will take you to our story with an interactive map of exposure sites. Also a list of the symptoms of measles. You can also find the story right on the homepage as well.